All right. So there are some injuries where you don't need an MRI to tell you that something went wrong.
Yeah, if an athlete says, I heard a pop, everybody in the training room just quietly nods.
Yeah. So today's episode actually hits a little closer to home than usual. Our guest is my son. He tore his ACL, and tomorrow morning he's going in for surgery.
And before anyone turns this off thinking this is going to be heavy, don't worry. He's walking, he's joking. He's already asking when he can lift again.
Yeah. He's also asking if this counts as leg day.
It does not.
All right. So today we're talking about ACL tears, what surgery actually fixes, what it doesn't, and why you'll be back is both true and wildly incomplete.
And we're doing it with someone who's living it in real time, not 10 years removed with a highlight reel.
Oh, who could you be talking about, Kathy?
wouldn't
All
know.
right. Okay. Let's get into it. This is The Pitch. What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. Welcome to the Pitch Podcast. I'm Dr. Jason Young.
Now I'm Dr. Kathy Lynch.
And this is, who are you?
I'm the oldest son.
Okay.
No, I'm Alston. I'm Jason's son.
Yeah. So clearly he listens to the show because he knew the lore.
The lore.
The lore.
I know ball.
Yeah.
He knows ball.
He knows ball. Yeah. So welcome. Thank you for being on the podcast.
Yes.
Kind of a last minute addition.
Yeah.
So we'll see how you do.
We took a pivot, no pun intended.
Yeah, geez. Oh, that's
sorry.
that's
That was a
how
bad
these,
dad joke.
That's how
Very
these
good.
things
Not
go.
even a dad.
Yeah, I don't know. And a little earlier before we started, he was claiming that he's taking over the podcast. So this
Okay.
might be my last episode. It'll just be called the Patal, the Patal.
The Patal.
Yeah,
The
the Patalston podcast.
Talston.
like that.
Because he's replacing the CH.
Mhm.
All right. So before we get into it, can we brag about the podcast
Please.
a little bit? Let's brag about the podcast. So we hit a milestone. No, a milestone. Oh, today's
too.
going to be a
a good one.
struggle. No, a real struggle.
Nobody's perfect.
Nobody's
Oh,
perfect.
yeah.
No,
Nobody's
perfect.
Yeah,
Yes.
especially not me. Okay. We hit a milestone on YouTube. We hit 1,500 subscribers. That's pretty good. And we're not even one full year in
No,
yet.
almost.
The anniversary is actually coming up next month. We're a few
Wow.
weeks away.
Yeah.
We might have to do something big.
Real big.
Yeah, get Raul a cupcake or something like that. Yeah. Raul, you like vegan, gluten-free cupcakes? I don't know.
Anything.
Cheap date. I
Okay.
guess.
Yeah, so the Pitch Podcast first birthday party is coming up. I don't know. I'm promising a party, but
Yeah.
every episode's a
Why
party.
not? That's
Yeah.
the truth.
So if you would like to be subscriber number 1,501, that's great. Also check us out on Spotify. Like, where's all of our Spotify
Yeah.
subscribers?
Where's
You know?
everybody?
Yeah, come on. It's like we're turning into that YouTube. I've got a YouTube channel trope.
Mhm.
I want to be I've got a podcast on Spotify
Mhm.
trope guy.
Mhm.
Okay.
Nice.
All right.
Anyway. All right, son.
What are we talking about today?
Yes. All right. So talk us through it. The ACL tear. First of all, tell us about your sports. What do you do? Why does this matter? Break it down for us.
All right. So I was a 3-sport athlete. I play basketball, baseball, and football.
Wait, do you go to the best high school in town?
I do indeed. I go
absolutely.
to Corvallis High School.
Okay.
Shout
Go
out to you.
Spartans.
Mhm.
Go Spartans.
Sparts.
Mhm.
So this my junior year of football, we were head down to Central for a must-win game if we wanted to make playoffs. At the time, I was in a mini position battle for quarterback, so I was out there at corner having fun. And then on one of the plays, I went and tried to punch the ball out, and I tackled me and my opponent into my knee, and so I had to go out for the game. When I got checked out, they said sprained LCL, which sound made up to me. So I was like,
Yeah. Well, really quickly, maybe we should pause and
Yes.
and the professional here should let people know what is an LCL, Kathy?
The LCL is the lateral collateral ligament.
like what?
Yeah.
Still made
Yeah,
up.
he's like, whatever. Yeah.
Collateral.
It is.
Yeah.
It's the ligament on the outside of your knee.
Right. It gives you some stability.
Yeah.
Right. And we checked you out. Right. We checked out your ACL. We checked out your MCL, your PCL, your LCL, all the CLs.
meniscus, yeah.
We got all the CLs, all the
Mhm.
meniscus and everything. And Kathy, you were kind of in on this. Like,
Yes.
what were we thinking diagnosis wise at this point?
I saw some definite instability. Just I'm gonna say laterally, so side to side. When I checked out his knee, we were thinking also there might be a meniscus tear, but otherwise, he was fully active in his off-season workouts, jumping, running, squatting, deadlifting, doing all the things.
Yeah. And that injury kind of did it for your football season.
Yeah.
Right.
Yeah, it was kind of week to week, but I never suited back up.
Mm.
Yeah. So like it hurt, but it was still kind of serviceable, but just never really good enough. I mean, pretty dynamic athlete. Like
Mhm.
you, what would you be classified as? A dual threat quarterback? Yeah.
I like to think so.
Yeah. Okay.
Are we
good.
talking Lamar Jackson? Are we talking Kyler Murray?
Yeah.
Well, I'm not too tall, so probably Kyle.
Right.
Okay.
Okay. So yeah, so mobile quarterback, and so if you were just a pocket passer or something like that, could have gotten in, maybe like thrown the ball, but just really to utilize the full skill set, took the rest of football off. Okay. Basketball season comes around because 3-sport athlete, and what was the decision not to play basketball?
Come basketball season, it still wasn't 100%, especially towards the beginning of basketball season. And I don't want to be the type of guy who like assumes that he's on varsity. So I said I'm just gonna take this time to recover. You know, hopefully get big in time for
Yes.
baseball and football. And so yeah, I decided it was better take it off and get healthy. So
Yeah, lots of creatine.
Yeah.
So
that's
much creatine.
So much.
Yeah.
Do you have a favorite brand?
I do.
Yeah.
I'm not going to say their name
all right.
until they promise to sponsor us, or at least be guests on the podcast.
Right.
Yeah, that would create such an awesome opportunity if
For
they
both
would
of
just
us.
create an email to me. Yes, and say that they would be on it.
they
So
create great protein gummies.
they do.
Mhm.
Or,
They do.
creatine gummies.
Yes, they
Yes.
do. Yes,
Yes.
they're quite creative.
Tiv.
I would
Mhm.
agree.
Yeah. So, yeah. So, decided to drop basketball season, which was a big deal
Yeah.
because there is an award that you were after.
Mhm.
What is it called? The Johnson Award? Is that what?
I don't know.
Or
12 seasons,
Uh-huh.
PTCH. You know, basketball was my first love. And yeah, so it was a really big bummer. But
Yeah.
I decided that my knee was more important than an award. So
okay.
Mm.
So rehabbed it, and
Like crazy.
we deployed all the tools.
All
I
of
know.
them.
Yeah.
I'm extremely lucky. I got lots of resources and I used them all. So
Yes. And then so you get to the point where it's like, okay, basketball season, that one's gone. And it's time to start training for the next sport, which is
baseball.
baseball.
Boy,
Okay.
was I excited.
Yes.
Oh.
So
What do you
got-
play in baseball?
I'm an outfielder.
Okay.
Yeah.
Fast. He's fast.
Yes, he is. In fact, this is probably a good time to talk about what does your mom yell at every single game?
She yells two things. She yells super cute, bub.
You're super cute, bub.
Oh.
Or she says, you're so fast.
You're so fast. Yeah. So, okay, let's
Where
put
does-
this
where does he
on
get this
record. Mom doesn't watch this, so you can
Yeah.
say what you really feel.
She would disagree with you there.
The only time she watches these is when we're driving in the car together, like we're going to Portland or something like that, and I put it on. And I'm like, oh, and she's like, oh my gosh, you still have a podcast?
Is that where you go?
Wow. Yeah. Okay. So, how do you feel about that? When like it's embarrassing? I think if my mom was yelling, "You're super fast, Jason," which let's be real, she never would. because she wasn't a liar.
And yeah, that's what I was gonna
I'm faster than
for
you.
both the things.
Yes. Hold up.
Now, how do you feel about that? Is it a little weird?
Um, I don't know. She's been doing it my entire life.
Okay.
So it's a little embarrassing, like for the first little bit, but then it's like,
That's
who
my
cares?
mom.
No one
Yeah.
else's mom is doing that, so suck
Yeah.
it.
Mhm.
Yeah.
Well, the good thing about Mandy is she doesn't just limit it to you. She,
She makes sure to tell the entire team that they're super cute and super fast.
Oh, team mom.
team mom. Yes. It's the real thing.
Yes.
All right. So we're back in baseball,
Mhm.
and knees looking pretty strong. Would you
Mhm.
agree?
Yeah.
Yeah, I was
Yeah.
pretty happy with
Yep.
his progress.
Yep.
If you had to grade it on a scale of 0% to 100%, where would you say your knee was at that point?
I give it like a solid 85, 90.
Okay.
Okay.
Yeah.
Yeah.
Yeah. Weren't quite stealing bases, but could definitely do the drills. I know
Mhm.
before that, you were having some trouble planting whenever you swung. You were past that.
Mhm.
Done hitting off a tee.
Yeah, I started moving to live a little bit.
Mhm.
Okay. All right. So then take us back to that fateful
Oh,
day,
man,
Alston.
this is painful.
Okay, so let's see, what day was that? That was like
It was January 8th.
January
As a matter of
8th.
fact.
Yes.
January 8th, 2026.
It was a dark and stormy night.
It actually was a dark.
It was dark.
Yeah.
And
night.
it was wet.
Yes. Which is important. This is an important piece of the
very
story.
important detail. So we just got done in the cages, doing our warm up and everything. I think I hit a little bit before, and then we're headed out to the field. Just ready to play some baseball. I was excited, and then we're doing this drill where, because I'm an outfielder, we field ground balls a little differently. So we're doing a drill where we're sprinting to our left, and we're trying to field and then turn quickly so we can throw. And on the very last rep to the left side, I'm going, and then I plant to grab the ball. My foot slips, it straightens out, it pops, and I like fall over it. So the coaches rush over, and one of them had my dad's phone number, so I call my dad, and he's like, "It's probably just a hyperextension, So I keep it moving. Yeah, kind of reminded me of Central, but I was like, whatever, it's just sensitive. So I've been walking around a little bit, and then eventually I head into the trainings room, and they said I probably re-sprained my LCL. So that was kind of a bummer. Then I go see Kathy the next day because I had an appointment with her, so that was really cool. Do you want to talk about what you thought?
Yes, Kathy.
Yes. So this is the interesting part. He comes in, he's really still pretty swollen and super it was still pretty painful. So at this point, we're thinking, maybe this is a bigger meniscus tear at this
Mhm.
point, because I do all the ACL tests. I check the medial collateral ligaments again. Still some laxity there, but none of the ACL tests are popping out positive to me. So
Yeah.
I was
And the trainer was the same thing.
Same
So
thing.
she tested the ACL. I tested the ACL. We go through all the orthopedics.
Yeah.
And just kind of a little loosey goosey. But
Yeah.
I mean, initially my talk was, hey, probably not much to worry about. Maybe you re-aggravated
Yeah.
the knee, and let's just keep rehabbing it.
Yeah, let's get
Yeah.
it calmed down.
Mm-hmm.
Yeah, so that's what we started doing.
Mhm.
And then he was back kind of walking
Yeah.
again. But
Yeah, I got to the point where I was hobbling around. So I was thinking I come back a couple months, maybe miss the start of baseball season, but oh well. And then I get an appointment at Beaver Sports Medicine.
Yeah,
to,
first of all, like time out here.
Yeah.
Beaver Sports Medicine, those guys were awesome. They got him right in,
Mhm.
and it felt kind of like we were cutting to the front of the line.
Yes,
Yes.
big thank you.
Yes,
Yeah.
big
Beaver
shout out to
Sports.
them. Dr. Wobig and Painter, who was here on the
Mhm,
show
mhm.
before, and MB and all those folks. Yeah,
Todd.
they did a great job. Todd and imaging. So
Todd and
mhm,
imaging,
yeah.
gotta love Todd.
Yeah, so we get in there, and what do they say?
Well, the first appointment, they took an X-ray of the knee. Nothing's broken. Just kind of talking to me about my knee, and they do some tests that everyone else had already done. So I was like, whatever. And so we scheduled an MRI for just a little bit after
The
that.
next morning, yeah.
Yeah, next
Mhm.
Really, was
Yeah,
it?
it was the next
Wow.
Yeah.
morning. Yeah.
Next morning.
Yeah.
And so yeah, I show up for that. They have an open magnet MRI. So I just kind of sat in there, not claustrophobic or anything, and took a little snooze.
So this is a surgeon looked at your knee.
Yeah.
Yeah.
The athletic trainer again looked at the knee,
Mhm.
and both of them weren't positive that there was an ACL tear at this point.
Yeah. They're both.
Dr. Wobig had some
Oh,
suspicions.
did
He was
he?
like, it feels a little bit. And like everybody else was like,
No,
yeah, yeah. But this is why orthopedic surgeons are the real deal. It's like
Mhm.
this guy, yeah, he knows what he's doing. And
He knows.
so it was a good call to get the MRI.
Yeah.
Yeah.
So what did we find?
So my dad and Painter play a little phone tag, trying to
Uh-huh.
get some information out, and my dad relates to me that my ACL is torn, and
Not
maybe
just a little bit either.
Mm.
It's
yeah,
that sucker's
completely
gone.
torn.
You
Yeah,
did
it's
it,
gone.
100%. You
Mhm.
went all out, man.
All the way.
Yeah.
Yes. Does nothing halfway.
No.
So.
Yeah, and then they said maybe a sprain in the MCL, and then maybe a tear in the meniscus. So, yeah, that's kind of a hard rock to swallow,
Yeah.
Mhm.
but you know,
Okay, so this is a good time to kind of jump in. So when I finally did get to talk to Painter, it was kind of cool. So you could tell this is a guy with like decades of
Mhm.
experience because the
Mhm.
first thing that he wants to talk about is Alston's mental state.
Yeah.
More interested in how you're going to feel about this than what's going on with the
Yeah.
knee. And so that was cool. So I don't know, like how do you deal with something like this? Because an ACL injury, first of all, if you're doing sports like baseball, football, basketball, soccer, where you're pivoting, you're starting, you're stopping a lot. Uh, when you have a rupture of your ACL, repair is not optional. If you're old and you're just going to be running in a straight line, maybe you could live without an ACL. But if you're old and you're going to be playing pickleball, you're going to need an
You're
ACL.
going to want your ACL.
Right. So can you talk a little bit about this? Like, what was this like for you emotionally, mentally? Because let's pretend that one day this podcast gets super famous and there's a high school kid, maybe somebody who is going to be the quarterback who is going through this. Like, what was that like for you? And how are you doing? How are you getting through it?
the first night was really hard.
Yeah.
It took a little bit to like really realize that like so with the surgery, it comes with a recommended like 9 month ish uh like time away from competition and sports.
We'll talk a little bit
Yeah.
about
Mhm.
why that is
Mhm.
in a second.
So that was hard. That meant no baseball for sure. I was really looking forward to this baseball season. Probably no football. Hopefully come back for basketball and then like senior basketball, senior baseball. Um, so it was kind of hard, kind of like processing that. I had like high goals for this year. Like one of my resolutions was to win a state championship in one of the two sports that I can't play now. So kind of sucks. But then I eventually reached a point where it was, I can't do anything about the tear. Like I can't do anything to change the fact that I tore it or the
Mhm.
fact that I can't participate in these. So now, like I just gotta do everything I can to make sure that you know I can get better. And when I get better, I'm better than I was. So yeah, been trying to focus on me as a person, not just me as an athlete, and been doing lots of prehab, trying to get that quad as strong as I can. So
Yes.
yeah.
Magic words.
Prehab.
Quad.
Quad. Oh yeah. Yeah. Well, and I really appreciate that.
Mhm.
I probably cried more than you did.
Yeah.
Um, so
Yeah.
yeah, it's not a fun thing
No.
to figure out. Oh yeah, geez, how do we tell you this?
Yeah.
But I think it's really admirable the way that you've been dealing with it so far. And like, I mean, you're not all the way down the road yet. I'm sure there's going to be ups and downs, but I like that you've been looking into like how can I still be a leader and participate in everything. And I think that's one of the things. That's one of the reasons parents want their kids in sports is because of those life lessons that it teaches. So.
Yeah.
Thank you for sharing all that. Yeah.
The night you told me,
Hmm.
or I think maybe it was the morning that you found out, and my heart just broke for him because I knew he was looking forward to baseball. I knew he was going to be starting quarterback in the fall, and just knowing the timeline, it just was going to take those 2 seasons from him. unfortunately. And so, and when I've seen him since, like you've been pretty low key about it and pretty even keeled, which I know that those first couple days are rough when it happens.
Yeah.
And to tell a little story, we're going back to my glory days.
Yes, let's do it. Tell the story.
So, welcome to the club. It's not a club neither you or I want to be in, but I did tear mine when I was a junior in college too. It was January actually. Mine was January 19th. I still remember the day.
Bad month.
Yeah, really bad month. Yeah, I still remember the day. But I was devastated because this was the 90s, and back in the day, ACLs were like almost a career ender.
Yeah.
Yeah.
They were going to repair you with a chainsaw.
Yes.
Right.
Yes.
Get a little chain link going.
Right. Exactly. Like
Yeah.
they give you the what is that? The not the formaldehyde, the chloroform, and then you may or may not wake up with
Yeah.
the lower leg.
Yes.
Yeah.
We'll see what happens. Yeah. Yeah. They told me I wasn't going to play my senior year in college, and I played Division III, so it wasn't like I could redshirt and cut. My dad was going to pay a year of college so I could play basketball.
Yeah, and this was at Nazareth.
This was Nazareth. It's now university. Was college back in the day.
Very good.
Yeah.
Well, Jesus,
you
do watch the show.
He does. Yeah. Yeah.
Uh-huh.
Yeah. So I feel for you. I was devastated, but you're gonna make an epic comeback and have a great story to talk about.
Yeah, I think that's been getting me through it is that I've been told that I can become faster and jump higher. So
Yeah, I like it.
It's true.
Mhm.
Yeah, and I think we're going to talk about that a little bit, how successful ACL repairs are. In fact, so successful that I once read an article where there was a doctor who was talking about the idea of maybe athletes undergoing prophylactic ACL repairs because they come back stronger. So
that sounds awful.
yeah,
Well, yeah.
nobody's doing that.
Yeah, how about kids just we rehab, we prehab, we strength train, we cognitively neurocognitive training.
Yeah.
Now before the injury.
Totally. Yeah, do everything you can to prevent it.
Yeah.
And so I think, coming up in the episode, what we want to talk about are like what exactly is the injury? What are some of the causes of it? Who gets these types of injuries? And then like what does recovery look like?
Yeah.
And kind of what are some of the best secrets, the best techniques, methods,
Tricks.
prevention, recovery, and everything like that. So you ask some questions. Kathy's gonna do the heavy lifting because she's the smartest one here. I'm gonna try not to get too emotional. But before we do that, how about if we take a quick break so that we can hear from a sponsor?
Let's go.
All right. We're really selective about the tools that we recommend. Brain FM has really earned its spot. It's functional music built with neuroscience in mind, designed to support focus, relaxation, creativity, or sleep, depending upon what you need in that moment. Think of it like adjusting the lighting in your brain. Need deep focus? There's a mode for that. Need to calm down? Covered. Need to shut things off at night? They got that too. We use Brain FM while working, decompressing, and winding down at night. It's simple, effective, and easy to stick with. This isn't just stuff that you can stream through YouTube or Spotify. This is audio that's been engineered using cutting-edge neuroscience, AI, and real composers. You can get a 30-day free trial at brainfm/pitch podcast. Remember, there's no I in pitch. The link's in the show notes, and signing up through our link for the free trial supports your favorite podcast. Brain FM, music for the brain. And we're back. So, let's get into it. Let's talk a little bit about, let's talk a little bit about knees, what the ACL even is. We're going to defer to Kathy as our expert here.
Witness.
Yes, our expert witness. And I recently, for some reason, have become very interested in ACLs. So I'll share a little bit about what I've been reading lately and kind of what our plan is for getting Alston's knee back. And then I think that we should play a game after that.
Love it.
Yes, I've got a special game for you, son.
I'm excited. It's the best part of the episode.
Yes, it is. Yeah, I know you fast forward to the games. Okay. So, Kathy, what is an ACL? What does it even stand for?
It stands for anterior cruciate ligament. Why cruciate, you ask?
Cruciate, doesn't that mean cross?
Yes.
Yes. Yeah.
Like Jesus on the cross.
Right.
Um,
So the Catholics invented
They did.
the knee.
mhm,
Okay.
Yes.
Okay. Yes. We didn't
yes.
have them before that.
No.
Okay.
What do we have instead? Just straight bone to bone?
Straight bone to
Bone to
bone.
bone. Yeah. He does watch. Holy
Oh my
crap.
gosh.
Yeah. Man.
So
I'm glad we're not playing pitch podcast trivia.
I know, 'cause he knows it
He's
all.
gonna dominate. Yeah. I think he knows the show a little better than I do. All right.
So this little pesky little ligament that we seem to have torn in our life, it crosses between the femur and the tibia. So the femur is the big bone, your top leg bone, and
Your thigh bone.
your thigh bone is connected to the lower leg,
Your
the
shin
tibia,
bone.
the shin bone. And there's two little. I think they're like 22 to 25 millimeters long. These
Mhm.
two little ligaments connect the tibia and femur together.
Okay.
And they're cruciate because they do cross one another. And the ACL crosses over the top of the PCL, so the posterior cruciate. It can be torn too, but less common.
Yeah, so
ACL.
anterior means front, posterior
yes.
means back.
Yes.
Mhm.
Yes. And you technically don't need an ACL to walk. Why is that?
Because I'm amazing. I don't need anything to walk.
No, there's that too.
Oh, you're not talking about me
No.
specifically. Oh,
No.
gotcha.
What does the ACL do? So it provides stability to the knee, and it prevents what they call translation of the tibia anteriorly, so from front to back. So your shin bone translates forward and back, and the ACL prevents that translation usually.
So you're saying that if I'm taking a step and I don't have an ACL,
Mhm.
that bone on the bottom, the one that's
Mhm.
connected to my foot,
Mhm.
that wants to slide
It
forward.
wants to slide forward.
And
when
the
you're walking.
ACL helps pull that back
Yes.
so it all lines up.
Yes.
Okay.
Yeah. So, if you have a strong enough quad, this is going to be the theme of your life,
Mhm. Yes.
literally the rest of your life.
Oh, awesome.
You technically don't need your ACL. In fact, this is apropos of the times. The Olympics are coming up,
Yes.
and we just learned Lindsey Vonn, who is made a huge comeback.
Incredible skier.
Incredible.
Yes.
Just tore her ACL again. I don't
Oh,
know how many times
geez.
she's torn
Is that like
ACLs.
7?
At
Something like that?
least.
Yeah.
In fact,
Because I think that we talked about that with the surgeon, right?
yeah,
Yep.
Yeah.
yeah.
Uh-huh.
And she is gonna ski again. But if you've ever seen a picture of Lindsey Vonn, those quads
Yeah.
are
Oh,
monstrous.
gosh. Yeah. Well, and I think, speaking of monster
Yes.
quads, shout out to Alston's quads.
Yes.
I think that that's actually why we trained professionals had such difficulty determining whether
Yes.
he had a tear or not,
Yep.
because his quads were doing a pretty good job
Yeah.
of stabilizing
His
that.
hamstrings were pulling it back too.
Yeah, impressive legs, son.
Very impressive.
legs.
Good
yeah.
job.
Shout out to Kathy. Shout out to Coach Drew.
Yes.
That's right. Yes. So yeah, that's what the ACL does. We need it, but we don't need it. We need it if you want to do any pivoting. You mentioned earlier.
Mhm.
If we want to do pivot sports, if you want to play, get back to playing football or basketball.
Or pickleball.
Yeah.
We got to satisfy the demographic
We do.
here. Yes.
We do.
Yes.
Although
Or
they're
cricket. Yes. Yes. Right. Because for our folks in India.
Yes.
Definitely.
That was good. There is a not resurgence, but a surgence actually
surgeons, yes.
of athletes rehabbing without the surgery.
Mhm.
And so there are people who are attempting to play and are successful in getting back to high level sports without having the surgery. And again, that relies on, hardcore training, strength training, but people are playing without having the surgery. So not recommended at this time.
No.
No.
Well, and I think, so what would move you to a decision like that?
Mm-hmm.
I mean,
frame.
you probably remember what the surgeons told you in terms of why you would want to do a reconstruction. Don't ever say ACL repair, I've learned.
Yeah.
Yeah. Somebody will like slap your hand and say,
Mhm.
it's a reconstruction.
Yeah.
Okay, fine. Just fix it.
Yeah.
But do you remember, like, what are the reasons that they suggested a reconstruction for you rather than going without it? On the spot. I got you.
Probably
It has to do with something that you have that I don't, and that is youth.
Mm.
Yeah.
Oh, yeah.
Yeah.
I remember now.
Yeah.
Because I remember now. I
Yeah,
remember it all.
okay,
It's all
let's
coming
go.
back.
All right.
Yeah.
So there's the cartilage on the
Mhm.
top of the knee, and without the ACL, it can wear that down.
Mhm.
And so later down the road, that could turn into what they call arthritis.
Yes.
Yes.
So so taking care of it now prevents me from wearing down that, because eventually everyone's cartilage will wear down, but repairing it now will prevent it from wearing down prematurely.
Yeah.
Yes.
Very
Yeah.
well said.
Yeah. Totally.
Yeah.
Yeah. This guy does not want to be a doctor at all.
No.
No.
He
Yeah.
he listened.
He wants to be a podcaster.
All right.
Yeah.
Well, here he is.
Yes. This
Episode one.
is where the big money is. Yeah. So that's pretty much what they said was that somebody your age who has some sports ahead of them, this is going to give you the best long-term outcome. But once you get a little bit older, you got some options.
You do have
Yeah.
some options. Yeah. You don't have to have the repair.
Mm-mm.
Yeah.
Or you could just have perfect ACLs like me.
Ooh, I said repair. I meant reconstruction.
Oh my gosh.
Whoa.
Yeah.
I caught myself.
There's trainers across the country and the
Sure,
country
you
of
just looked
India.
up.
Yeah,
Looked up.
they just
She doesn't know what
they
she's
smashed
talking
their
about.
phones.
Blasphemy.
Yeah. Reconstruct this. Okay, so Kathy,
Mhm.
let's talk about because now people are terrified of tearing their ACL.
Mhm.
Who should be worried, and how does it happen?
Women should be worried.
Hey, ladies. Yeah. Are you listening, ladies?
And this is another controversy. I could talk about this for hours and hours. 'Cause
Mhm.
Obviously, this is deeply personal to me because I went through it. But women actually are like 5 to 8 times more, female athletes
Mhm.
are 5 to 8 times more likely to tear their ACL. And there's a myriad of reasons, and we really haven't pinned down exactly why. I don't want to go through them right now because,
Mhm.
again, that could be controversial when we talk about it. But yeah, people in pivoting type of sports, contact sports,
Mhm.
although the ACL is torn in non-contact
Yeah, so talk
situations.
about that.
Yeah,
Like, does it take somebody hitting you in the knee to pop your ACL? No,
clearly.
it does not.
No, it does not.
Yeah.
Yeah, and nobody was around me when I
Mhm.
was going up for a layup. So I was going up for a right hand layup. Yeah, I was going off my left foot, and I guess hyperextended my knee and popped.
Yeah.
And Jody, if you're watching, this is my teammate,
Uh-huh.
because I had the ball and I just chucked it.
Uh-huh.
It was the worst pain I'd ever had in my
Oh,
life.
no.
And Jody was coming behind me,
Mhm.
following because she thought I was going to miss the layup, right?
back down.
Yeah. Yeah, put back down. Yeah. And all I hear is
You know Jody. Yeah,
I
okay.
chucked it. She's like, "What are you doing?" And so
I'm carrying my ACL. Leave me alone.
So she's not listening. It's okay.
Yeah, right.
Anyway, so yeah, both mine and Alston's were non-contact injuries. So,
Yeah. The very first
Oh, here we
Yeah.
go. Yeah, can't leave you hanging.
yeah, the very first real-time ACL tear I ever saw was girls, I think it was the 4A state
Mm.
basketball tournament. Girl went down, she shot a three-pointer, she made the three-pointer, she
Mhm.
turned to start jogging back up the court,
Yeah.
then she laid down on the court for a little bit.
I'm done here.
cried for a while, got carried off, and I was like, "Whoa, what just happened?" I was looking for snipers.
Yeah,
I was like,
what it feels like.
did she get hit? But no, it's crazy. And
Yeah.
so the turf monster,
Yeah.
or the court monster,
Court
it
monster,
can
turf
come and
monster, yeah.
get you. So let's go back to because we alluded to the dark and stormy night, and you
Mhm.
talked about that the
Yeah.
field was a little wet. So what does that have to do with ACL tears? Like, does that increase risk, or does surface matter?
Surface. Do you remember? Surface does matter. Do you remember those rubber basketball courts?
Oh gosh, yes.
Oh
Uh-huh.
man, those things. And the AstroTurf back in the day.
AstroTurf, when it first came
when
out,
it first came out, was basically
it was
like fake grass on concrete.
yeah. If you looked at the AstroTurf too long,
You tore your ACL.
yeah, those suckers just popping. Or I've played a fair amount of church basketball
Okay.
in my life,
Yeah.
and
Played is a strong.
This is gonna be our best episode
Wow.
ever.
Okay. Great.
Showed up to church basketball.
Let me see. Which one of us could actually play church basketball right now?
I could do better than you.
Okay. All right.
Let's run it right now.
Hey,
Minus.
Raul, I think there's a problem with Alston's microphone. Maybe turn it off for a little bit, let it cool down. Thanks. Okay.
Overheating.
Anyhow, one of the courts that I used to play on, like, it was freaking carpet. Like, dude, like,
Yes.
Is it the Zion school one?
what's that?
Is it the one at Zion?
No.
I had some basketball trainings there, and it's carpet.
Oh, are you serious? Oh, man. Yeah, it's just like
those
the
should be illegal.
liability,
Mhm.
right? It's,
They should be illegal.
yeah, I mean, miracles.
Yeah.
Miracles.
It's because you're
But
playing church basketball.
It's right.
This guy's got
Exactly.
all the puns. I love
He
it.
does. I
I
know.
love it.
Well, I think we got to have Alston on more often.
Yeah.
Shoot.
Yes.
You should learn some things about health and wellness so that we can
Mhm.
have you on more often.
Mhm.
I mean,
I've learned more about my knee in the past couple weeks than any other body part ever.
Yeah,
You ever wanted to know?
totally.
Yeah.
Well, we're gonna have to have him on post-op.
Yeah, well, I'm
Yeah.
just going to suggest, though, that if you just want to be on the Pitch podcast, stop sacrificing pieces of your body
Yeah,
for it.
please.
And yeah, we'll just have you on because maybe you're interesting.
Yes.
You want to do an episode on name it. I got you.
we should
On
have. We
anything.
should have him on for one of our perimenopause episodes.
Yes, let's do it.
I-
Oh, his mic
That's-
doesn't work.
There's a line.
His mic doesn't work all of a sudden.
All right. Okay. So back to
Back
the
to-
ACLs. Back
yeah.
to the ACLs. Okay. So there's a few different types of repairs. You were offered a couple options, and you chose one, right?
Mhm.
What were the options that you were given? Why did you choose what you chose?
Okay, so I was offered patellar, hamstring, and quad.
Can you
Um,
explain the difference between them?
Of course I can.
Wow.
All right.
here we
So
go.
the patellar is probably like the most common one.
That's what I got.
hmm
Mhm.
So they take a ligament out of the front part of your knee, and they use that to reconstruct your ACL. Some downsides is that they put a screw in it, and so you have pain with kneeling and stuff like that. But really well tested, like it works. So yeah, and then there's the hamstring. Hamstring is like it's like a good one too.
Mhm.
You don't have that kneeling pain.
Mhm.
I've heard from people who've gotten hamstring that it hurts really bad. But like cosmetically, it's pretty nice and everything.
I don't think any of these feel great.
No.
I didn't hear anything about the quad. So.
Okay.
Okay. Yeah, I've heard
You-
the quad is no pain.
Okay, you can tell us on Friday. No.
So yeah, hamstring. Between the patella and hamstring, I would choose a hamstring. But I heard that you lose some strength in your hamstring, which I was really interested in.
I think it's a 10% reduction.
Yeah, that's
Yeah.
a lot. That's a lot of
Mhm.
percentages.
Mhm.
And then there's the quad, which I'm going with. The quad is like relatively new. Well, new compared to the other two.
It's a
So,
resurgence
yeah.
of it, for
Yes.
sure.
So
Not a
not too
surgeon,
common.
say
Not this
resurgence.
time. It's
Okay.
resurgence.
All right. Yes.
So, but they're gonna take. Oh, I should explain.
Yeah.
The
tendon?
hamstring. You have
Yeah.
like two things that connect to your knee,
Mhm.
and so they just harvest, which is a weird word to use, to be honest. But they harvest part of your hamstring and use that.
Mhm.
Mhm.
The quad. Is it one or two? Might just be one.
Quad tendon.
Yeah, I
Yeah.
think it's I think if I remember, it's two from each of like two kind of like little pieces of tendon.
Yeah. So I'm
Um,
doing that.
Yeah.
And,
He's like, whatever. That's what I'm doing.
So they're gonna use that to reconstruct, and I mean, I've heard it's relatively similar to the hamstring in the fact that like I can kneel and everything. Recovery time's around the same, but I don't get that hamstring strength reduction. They're also gonna do, I don't know what it's called, but they're gonna take something out of my IT band and help it to
Oh
stabilize.
yeah, I can't remember the name of that. It's the
Mhm.
lateral something or other. But yeah,
Yeah.
keep going.
So they're gonna do that, and then while they're in there, while they are in there, they're gonna
Mhm.
take a little look at my meniscus as well. And repair that if it needs to be, and yeah, that's the move.
Okay. Good. Man, that's a good synopsis. This
Yeah.
kid pays
He
attention.
does pay attention.
Yes. Mhm.
Yeah. I didn't get an option.
No.
They just said, "You're doing the patella tendon." I said, "Okay,
Yeah.
here we go."
Well, and I guess there's also an option for cadavers.
Yes, there is
a cadaver
cadaver. Oh.
tendon.
Yes, yeah,
But they tend not to offer that to younger people, higher failure rate.
hmm
I think one of the things that's interesting is whichever option you choose, they all have similar 12-month outcomes in terms of people are back to being able to perform their sports as long as they're, committed to the rehab. There's a little bit of luck involved. There's some
Yes,
people that,
sure.
the repair just doesn't go well, maybe for genetics or, how you heal or whatever it is.
So it'd be your fault.
It
Yes,
would be my fault if yours
absolutely.
doesn't.
Okay.
Like, I don't know personally because
thinking
I
so.
come from a long line. I don't know of anybody in our family line who has ever torn an ACL until now.
the first
Maybe
So-
maybe this is on
so-
mom's side.
Whoa.
Yeah, I don't know.
Anybody on mom's side that's torn?
I haven't really asked.
I don't know.
Mm.
You're a trailblazer. Look at you. Fortunately for you, not a Portland trailblazer. You're actually good at basketball. So.
Oh, I'm not.
Burn.
Whoa. Hey, now I love the Blazers.
Yeah.
Listen. Like, if I could just get paid to miss free throws like they do, oh geez.
Well,
Like, I would do it for so cheap. You just pay me $5,000. I'll go miss all the free throws you want.
no, there's talks of Giannis coming, which would not help that problem.
Well, that's
But
true, but boy,
it might help
that'd be
our-
great.
Our win problem.
That's true.
Yes.
That's true. This is like around trade deadline time. Like, I heard
Mhm.
Chris Paul is heading to the Raptors and
Still playing.
some other stuff. And
AD's moving
AD,
again
yeah, he's going to. Is it
Colin
the
Sexton.
Wizards?
Yep.
Wizards.
for
Yeah.
a lot of picks.
Yeah. And just as a side note, I saw some nonsense that says that AD is better than David Robinson. This is obviously nonsense from somebody who is not very old, who does not
Right,
understand
yes.
the Admiral
No.
and his complete dominance.
Absolutely.
Yeah. It is AI, right?
It's totally
It's
AI.
Russian bots on Elon Musk's Twitter.
It's probably Kevin Durant with his.
It's probably
Oh, his
what
alter
it
ego.
is.
Yeah.
Oh
Exactly.
my gosh, exactly. All right. So the repair happens. Kathy, where do we go from there?
What to expect?
Yes.
Day one, day
Mhm.
two. Day one, you'll be feeling pretty good
Yeah.
because you'll still kind of have the anesthesia. You'll be feeling pretty
Mhm.
good.
and
You
a
watch
nerve
things-
block.
You
Oh,
watch
the new
shows
one,
like
mhm.
Dazed and Confused, Friday, next Friday. Those are the reasons you're going to feel okay.
Yeah.
I do need like a trippy movie list.
It's right. Los drugs.
Try out Inception.
Maybe, yes, Inception. Maybe that's when you watch Donnie Darko for the first time. Who knows? Yeah.
Bill and Ed's, or was it Bill and Ed's?
Oh, Bill and Ted's Excellent
Bill and Ted's
Adventure.
Excellent
Yes.
Adventure,
Mhm.
yes.
That'd make a ton of sense.
Yeah,
Yes.
right. You're like, I understand this.
I could write another one.
one.
Right.
I get it.
Yeah.
Day two is when the work starts.
Oh, snap.
Yes.
Yes.
We're back. Day two, you're going to wake up and your leg's going to feel like humongous because it's going to be swollen. It's going to be stiff. It's not going to feel great.
No,
It's
They're
not gonna,
already humongous.
well, they're already big. They're going to be like 3 times bigger. So that's not going to be a fun feeling. Depending on whether they repair your meniscus or not, will depend on whether you're in an extension brace. And so if they repair the meniscus, usually they want you in an extension brace for 6 weeks and you're not weight bearing, which is a super
And that
big
will be
bummer.
the case with you. Right?
Okay.
Because Dr. McCrum, who's doing the surgery,
Yes.
he said with a younger guy, if he sees meniscus damage, if he sees a tear, he's going to repair it
Okay.
because outcomes are better. So,
Yep. Yep.
Shout out.
They cleaned out mine and I probably wish they would have repaired mine
yeah.
now that I'm 53.
Yeah.
Anywho, so day two is when we start our quad sets.
Nice.
Okay. Maybe we don't hook up NMES yet.
hmm
Why not?
I got a little ahead of myself,
Yeah.
but
Like, cook it.
we gotta get we gotta get it going because the most important thing you want to get back early is your knee extension. You want to get that to 0. You want that leg straight, or if you have hyperextension, you want to get symmetrical hyperextension to the other leg. This has become a therapy session for me, but I didn't get full.
okay?
I didn't get a symmetrical hyperextension.
Oh, Kathy.
I have 0. I got to 0
Mhm.
extension, but I never got to anyway.
You know what
This
I
was the
regret?
90s.
You
It
know,
was wild.
you know what I regret now? I regret that we didn't have Raul cue up some sort of violin music or something I feel like there's a few times we could have played this, when Alston's talking about me playing church basketball, when you're reminiscing about basketball, all those kinds of things. Yeah.
Anywho, yeah, so that's when the work begins, is day 2. And things progress better and better after the surgery.
Yeah. Well, can I jump in here?
Yeah,
Because,
please.
I've been hitting the research
Yeah.
machine,
Love it.
looking at the papers and and just
Look at the literature.
looking at the literature,
He's doing his own research.
which I learned on TikTok, that when somebody says the literature says, that they're about to make up a fact. So
Whoa.
that's what somebody told me after telling them what the literature said, and they didn't like it. Anywho, so I've been. We're in a fortunate situation where you got more resources than the average kid, right? And so I've been looking for all the weird stuff that we could do to you. I mean, for you, of course, son, for you. One of the early things that we're going to start is some neurocognitive training. So yes. So neurocognitive training, it's using things where it's like you're training physical response from outside stimulus. So like Blaze Pods, the one that we're using is called Rox Pro. Yeah, Rox Pro.
Pro X or
Right, yeah, the Rox Pro X. But it's things where it's like using your body to make decision making, like hit the blue button, hit the red button, those kinds of things. Or it has numbers that pop up and it's like hit the numbers in descending order. And you can even start that fairly early before you can even bear weight, because training the other parts of your body also help to train. Like, it's not like your brain is like, forget you, left leg, you're not a part of this. It's also training those neurological pathways. So we're going to get you started early with the neurocognitive training, which will be kind of fun.
Can I play Bop It instead?
Sure. Yeah. I don't know that there's any research on Bop It. And it's not going to be the same thing if you're playing like Xbox. Sorry, this is not enough.
That's not neurocognitive.
That's a lot of thinking.
No, it's just
No.
yeah. So,
No, sorry.
But neurocognitive is like big body movements and everything like that. So I think that'll be really helpful. And so that takes us through and then working a lot with the trainer at school to try and help decrease the swelling, get to range of motion, things like that.
Yeah, so first 6 weeks, really, really, really important. The term in the industry is called quiet the knee.
Yes.
Got to get the knee quiet, and that basically is, let's reduce the swelling, reduce as much pain as possible, but also walking this fine line between keeping it as pain-free as possible, but also getting range of motion back immediately. And that is especially extension. In my mind, extension, I like to really focus on extension right away. If you have meniscus repair, a lot of surgeons want you to restrict flexion range of motion to about 90 degrees. Again, it depends on the surgeon. Just because depending on whether the meniscus, is it a root repair? Is it not a root repair? Because if you force it into flexion, you can kind of damage the root repair. So flexion will come, and I've found in the people I've rehabbed is that flexion eventually comes. So extension is the one that we want to get back as soon as possible. So 4 to 6 weeks, or first 6 weeks, just trying to quiet the knee down, and then trying to get range of motion as back as possible. And then, we're firing on all quads, all 4 of the muscles, the first 6 weeks too, because you're probably going to be not in weight bearing if he repairs that meniscus. So we will really be working on getting that quad going. And then we'll also be working on hip muscles. Well, MB will likely be working on your hip muscles because those will atrophy as well. And those are really important when you want to get back to running. So that's first 6 weeks.
And then after that, we're going to get in the pool, and you're going to be doing some walking in the pool. There's a lot of really good research that shows that you get back some hamstring and quad strength, superior recovery there if you're working in the pool.
With all the pickleball players.
Yes, exactly. With all the pickleball players, get in the old people soup, start walking your laps in the pool. We're also going to do a course of shockwave therapy. So radial shockwave therapy, We're going to do 4 weeks of that, 3 treatments a week, working around that. What's been shown from a research standpoint, the literature says um, that people who do that, they get back to a full range of motion quicker, and you also get significant pain reduction from doing that. So we're going to be working the radial shockwave therapy, and all the while still doing the neurocognitive training and everything like that. When do we get back to like the good stuff, like the running, the weights, all that kind of stuff?
Well, that's where the testing kind of comes in.
Hmm.
So they used to say, "Oh, you can run in 3 months," and there wasn't a lot back in my day. They didn't do. Actually, they did. I did the Biodex testing,
Hmm.
and that basically tests your quad strength and your hamstring strength. And they test it compared to your non-involved leg, and they want a certain percentage depending on the surgeon, depending how you're looking, at least 80% limb symmetry index. So you want your surgical leg strength to be at least 85% of the non-surgical leg strength before you're doing any kind of running. So that will just, based on that timeline,
Hmm.
generally not running before 3 months, but also, we'll get you tested at 3 months to see what your strength is then, and then we'll go from there. Yeah.
And then the strength and the pain tolerance and the swelling,
Hmm.
all those things factor in. But one of the most important things whenever it comes to being able to return to play, being able to return to your full activities is a process called ligamentization.
Hmm.
And that is probably the main limiting factor in terms of being able to get back 100%. And like you mentioned, they're taking some quad tendon. Quad or tendons are not the same as ligaments.
Mm-mm.
They're very similar, but they're not the same. And we're taking a tendon and we're replacing a ligament using that tendon. And so there's a process called ligamentization, which is where we're waiting for the grafts to heal. The grafts are where you attach that tendon at each end. So we're waiting for those to heal and for that tendon to start behaving like a ligament. So the minimum amount of time for that is around 8 months. And, yeah.
Wow.
So
Anywhere from 9 to 8 to 1 year.
yeah.
Hmm.
So and it's different people. Again, this is where a little bit of luck comes in terms of how your body decides to adapt to that. But I don't know. Do you remember what Dr. McCrum said in terms of your percentage chance uh, based on when you come back? So after 6 months, um, how how much do you decrease your percentage chance of re-injury if you wait a month?
It was like 5% or
15.
15.
Hmm.
Yeah.
15.
So if you try and get back to sports at 6 months, I think it's like a 30 or
Hmm.
it's like a 30 to 50% chance that you could re-tear. If you wait till the seventh month, you decrease that by 15%, not
Hmm.
15 cents.
That too.
Yeah. And then, each month you get a better shot of not re-injuring until when like you're at about a year or so, if you've got the full range of motion, you got back to that reasonable side to side strength, it's really pretty solid.
Hmm.
They say that it's stronger than a natural ACL.
Hmm.
I hope so.
Yeah. And generally around 5 to 6 months is the danger period, because your rehab's going to go so good. You're going to be feeling so good.
Mhm.
You're going to be tempted to be like, why can't I just try this? Feels real good. You're not going to have a lot of pain. You're going to feel super strong. And the exact point that your dad just made is that ligament just isn't ready for a lot of the pivoting, a lot of the counter jump, those kind of things. And so,
Well,
um,
and the other thing that happens besides just re-injuring that ligament is the other structures in the knee are at risk. And so when you have a chance of re-injury, we're also talking about the risk of tearing a meniscus, injuring the ACL or meniscus on the other knee.
mhm,
And so it sucks, but it's a good process to just be patient in. And if you are patient, you can have a really good outcome. Most people who have ACL surgeries have really good outcomes. Look at Kathy. Look how successful she is.
look at me now.
Yeah, look at her.
Just
Look at her.
take a look at me.
Yeah. If you're just listening to this in your car, pull over, turn on the video. Look at Kathy. Look at her. She's wonderful. Yeah.
Look at this. Look at me now.
Well,
Yeah.
do we have anything else to add?
We could talk, I could talk for hours about this. And you know what? Maybe
You
we
warned
have,
me.
maybe we have him in for like a post-op check in
Yeah.
2 months.
Okay.
See how rehab's going.
Yeah, we could do a few of these. This is
Mhm.
part one.
Oh yes.
Oh,
This is
no.
part one. We might have to set up like a little thing where you can like rest your leg on it or something. But yeah, or maybe this is good. Like, I just thought of great bonus content.
Oh.
I'll take some video of him high.
You're gonna have to pay
like,
for that.
like the wisdom teeth videos. Yeah. Mhm. No, we will not do that to you. Why? Because you're so cute, bub.
Thank you.
Oh,
Yes.
you're super fast.
You're super fast.
Nice little call back there. I see it.
Yes.
Yeah,
You
okay.
like that?
Is it time for a game?
It is time for a game.
go.
I got to find the game, though. What happened to it?
I already
Uh,
won it. I beat it. It's done.
He's a winner.
shoot. Maybe I got to find it on my phone. All right. Oh, I grabbed my phone and I just got a message from somebody that said that they are praying for you. Oh, you know what? This is your baseball coach.
Oh,
That's who it is.
wow.
He says, thinking about you as you head into tomorrow, we'll be praying and pulling for you. So great coaches there at CHS.
Yes.
Is that
Mhm.
Daisy?
Mhm.
That is
Of course
Coach
it is.
Daisy. Good old
He's the
Eric
man.
Daisy. Yeah. Okay. Anyhow, let's find this game. Oh, yes. Okay, we're gonna play a game that I call left, right, or both. All right. This is we're gonna see the elite ranks that you've entered, having torn your ACL. I have high level athletes who have torn their ACL and have gone on to, in some cases, become Hall of Famers or maybe the greatest of all times at what they do. Okay. So I'm going to tell you that athlete's name, when they tore their ACL, and you're going to tell me, did they tear their left one, their right one, or did they tear both? Ready?
Mhm.
All right, here we go. The first one, Adrian Peterson, running back. You know who he is?
Yeah.
Okay.
What?
Yes.
Okay, I'm
Wow.
just seeing. I
What?
can't,
I
bro.
mean,
I can't remember how old you are
Yeah.
sometimes.
Bro, what?
Yeah, he tore his ACL when you were 2.
Okay, but I
Okay,
know
and
who,
you probably still knew who he was. Okay.
Okay.
no, I just know who Adrian. How do you not know who Adrian Peterson? is?
Okay. All right. So
I
left
played the
ACL,
Madden. I played the Madden that
Yeah,
Okay, all
there
right.
it
Come on
is,
now.
Madden.
Come on now.
left, right, or both.
I'm gonna go with both.
He tore his left ACL.
Oh.
Yep, 2011. It was an ACL and an MCL, but he returned to win the 2012 NFL MVP. So that's
So
good.
MVP next year.
MVP next
Yeah.
year. Okay. Derrick Rose.
Oh, I know this one. What are you talking about?
Left or right?
Oh,
Left,
yeah.
right, or both?
Frick. It's gotta be his right.
That was also his left. Another left ACL. Torn in the 2012 NBA playoffs. Okay.
Yeah, I remember. I've seen the clip everywhere.
Yes. What about Klay Thompson?
Oh man,
Oh.
this was recent.
At 2019 NBA Finals Game 6.
His right.
This is also his left ACL. And then he had an Achilles rupture later in the right leg.
Yeah. Oh, okay,
Yeah.
that's what it was.
So,
I remember him hobbling off.
Oh,
his leg
yeah,
up by his
that's
mouth.
right.
all right, Saquon Barkley, left, right, or both?
You know what? I'm gonna say left.
This is actually the right.
Of course.
Torn in week 2 of the 2020 season. And did he come back?
Yes.
Yes, he came all the way back. Very
Mhm.
good. Frank Gore. Do you know who Frank Gore is?
Yes, I knew Frank Gore.
What team do you play for?
Niners.
All right, good
Come on
man.
now.
Okay, I'm just checking. What college do you go to?
Okay.
All
I
right,
don't know that.
University of Miami. Okay, go ahead.
Oh, I might have known that actually. Right. Right. Opposite of left.
Both. It was both. He tore his right one in 2021 and his left one in 2001.
I was
His
like,
right
kind of
one 2001, left one in
post-football.
2002. And that's a case where he probably tore his left one because he came back a little too soon on his right one.
Mhm.
But then he went on to play just 16 NFL seasons. What about the greatest quarterback of all time?
Aaron
No,
Rodgers.
I see.
Oh.
Now listen. If I could only choose one quarterback, it's Joe Montana.
Oh, okay.
Yeah, absolutely my favorite
Okay.
quarterback
Steve
of all
Young?
time.
But
Steve Young is right up there too. I've got a great picture that will make it into the premium content of me and Steve Young. He's wearing a green R2D2 shirt. Okay.
nice.
Yeah, Joe Montana is my favorite of all time. But Tom Brady is the greatest NFL quarterback of all time.
He won 8 or
He
9.
Yeah, 9. He won.
Nine.
Did
He
the
won
Tom Brady or Aaron Rodgers?
too many championships. Aaron
Aaron
Rodgers.
Rodgers,
Whoa, that's
not
not-
even close.
Aaron Rodgers.
That's not crazy.
It is
Why?
crazy.
Why would you say that's not crazy?
Even close.
Aaron Rodgers is insane.
Okay, Aaron Rodgers
The-
is insane. His dad
Yes,
was a chiropractor.
clearly.
That's most of the reason. But yeah, no, what? Very good quarterback, but he's not Tom Brady.
I don't know, man.
Look, so Tom
He
Brady
doesn't have the stats, but like if you look at him play,
mhm. He doesn't have the stats. He doesn't have the rings.
okay, yeah,
You know.
yeah.
Okay.
It's-
Anyhow,
never
he had a nice mustache at one point. Yeah. He didn't get the COVID vaccine. No, so, all right. Tom Brady tore his ACL. Which one did he tear?
It's gotta be the right.
He tore the left one. Yes, 2008, week 1 of the season. Also tore his MCL in the same play. It was a non-contact planted leg,
Mhm.
and
Oh wait, that actually makes sense.
yes,
Yeah.
And what did he come back to do afterwards? Well, just everything.
Yeah.
2008.
Yeah.
Super Bowl.
He won a
Yeah.
bunch.
Yeah, he just like lost count after that. So, so first of all, there's a pattern that we see here. Lots of left ACL tears.
ACLs.
Why do you think that is?
I think it's because of the foot you plant on.
Yeah, these are
Mhm.
right-handed athletes,
Mhm.
right? And so, which ACL did you tear?
My left one.
The left
There
one,
we
right?
go.
Right-handed athlete. So,
Very interesting.
yeah. So there's definitely some patterns to it. But I think I just throw this out there. These guys all had it. Kathy had it. You're destined for greatness. Right.
MVP in Super Bowls.
Yeah.
Yeah.
Up next.
Tell me one thing that anybody ever did that was great who had 2 like natural ACLs. It's very
No.
very rare.
It's
It's
never
very
great.
rare.
Losers.
I mean, he has the
Yeah.
ankle thing.
Yeah,
Oh, yeah.
ankle thing.
What about like Michael Jordan? Have you ever heard of him?
Never heard of him.
That
No,
guy.
just kidding.
He seems like he's pretty
Also
good.
the greatest of all time. So yeah.
No doubt. Yeah.
yeah,
Absolutely.
we're not going to have the argument about LeBron
Nope.
and Michael
Nope.
because it's different universes, and
Yeah.
LeBron played for way too long.
It's like Babe Ruth and like Shohei. Well, I think Shohei's better, but
I like Shohei better. Yeah.
yeah.
Mhm.
But like, never mind.
Okay.
Yeah.
Yeah.
Well, take homes.
Take homes.
Yes.
What doesn't kill you makes you stronger.
Okay. That's very nihilistic. Yeah, very good. Kathy went Nietzsche on us. Yeah. Mhm. Uh-huh.
That was Kelly Clarkson.
Oh, Kelly Clarkson, right. Yeah. Yeah. Nietzsche borrowed it from Kelly Clarkson. I forgot. Yeah. I'll go next. I think in researching for this, I pretty much just said it. You're in really good company,
Mhm.
and you're going to be fine. And so whether it's you or somebody else out there who's dealing with an ACL tear, you're going to be fine. Your leg's going to work again, and your life is going to go on, and you can be the best at what you do,
Mhm.
even though you have an ACL tear. And we'll give you the final take home, young man.
I would say, your ACL doesn't define you. So,
Yes.
especially if you're an athlete,
Yep.
doesn't mean that you had to stop being involved with your sport.
Mhm.
Your new sport is rehab, so
Yeah.
that hard. And yeah,
All
Love it.
right,
New
good.
sport is rehab.
Yes. There's one more very important thing, and if you want, you can say it with us. There's no I in pitch.